we think about healthcare safety, our minds usually go straight to the professionals. Yeah. Doctors, nurses, the people running the hospitals.
Mm,
But what if some of the most crucial insights, the things that could really change things for the better, actually come from, well, from patients?
exactly. And that's precisely what we're digging into today. We're doing a deep dive into this really interesting study that developed and tested a new tool. It's called the Patient-Reported Safety Concern Tool.
Okay.
And its whole mission, really, is about giving patients a proper, structured way to voice their concerns and help improve safety.
Right. So in this deep dive, we'll pull out the key stuff from that research, give you a shortcut to understanding how looking at things from the patient's angle is shifting safety. And honestly, there were some surprising findings. So let's start with the basic problem they were trying to solve. Traditional safety reporting. Well, it doesn't always catch everything, does it?
Not even close, often.
Hmm.
A lot of patients, they just don't report concerns. Maybe they're afraid of, repercussions. Or sometimes there just isn't a clear, easy way to do it.
Yeah, I can see that.
And this means critical information gets lost, especially things like near misses.
Ah, near misses, like when something almost goes wrong but gets caught.
Precisely, like almost getting the wrong medication, but someone spots the error just in time. Those moments are absolute gold mines for learning how to prevent actual harm later on.
But they often just vanish.
Yeah.
No record.
Exactly. They often go unreported, which is a huge blind spot.
Okay.
So to tackle this patient-reported safety concern tool was developed over in Wales. They used a two-phase qualitative study.
Qualitative, meaning talking to people, getting their experiences, not just crunching numbers.
That's right, in-depth stuff. They ran online focus groups and then these things called cognitive interviews with people who use healthcare services. This was back in 2023, between January and September.
Okay, so phase one, the focus groups, you said there was something really illuminating there.
Yeah, this was fascinating. Participants really preferred the term safety concern, much more than words like incident or event.
Huh. Safety concern. Why did that specific phrase click so well?
Great question. And the answer tells us a lot. People found safety concern just more relatable, more inclusive. It wasn't just about physical injury.
Oh.
It covered emotional harm, too, feeling neglected, not being listened to. Some people even said the term made them feel like the health system actually cared about their safety.
Wow, that's powerful.
It is. And what was also interesting was how broadly they defined safety. It wasn't just, did something bad happen?
Hmm.
It included feeling cared for, respected, getting clear communication, fairness, trust.
So it's much bigger than just avoiding errors.
Absolutely. It's a whole environment.
Wow.
It suggests that real safety needs that foundation of trust and good communication. Things traditional reporting often completely misses.
Right. And that feedback directly shaped the tool then. You mentioned changes like the recall period.
Yeah, exactly. That feedback led to refinements. They initially thought about a shorter recall, but based on feedback, they looked at extending it.
Okay, so then phase two, the cognitive interviews, what happened there?
So cognitive interviews, that's where you basically ask people to think out loud while they're using the tool. It helps you see if the questions are clear, if people understand what's being asked.
Makes sense.
And those interviews largely confirmed the tool was clear, relevant, led to a few more tweaks. For instance, that recall period. They finally landed on 12 months.
Why 12 months specifically?
It lined up well with typical follow-up schedules in the NHS, that's the UK's National Health Service. They also specifically added ambulance services as one of the settings people could report on.
Gotcha.
The final version, they called it 3.0. It tested really well for validity, meaning it measured what it was supposed to measure. And importantly, people said they'd be very willing to actually fill it out regularly.
Okay, so let's connect the dots. What does all this mean for you listening? This isn't just paperwork, right?
Oh, definitely not. This is much bigger than just a new form.
Yeah.
This tool, it helps uncover safety issues that the usual systems just don't see.
Because it's coming directly from the patient's experience.
Exactly. It gives you these unique sort of holistic views, including those near misses we talked about.
Mm-hmm.
And it helps get past barriers like fear, especially because it's designed to be anonymous.
Right. Anonymity is key there.
Crucial. So if you think bigger picture, this patient data doesn't replace the hospital's data. It complements it.
Yeah.
It gives a much fuller, more rounded picture of what safety actually looks like on the ground. It's about empowering the people right at the center of care.
Yeah, it really feels like giving patients that structured, actionable voice is incredibly powerful, a really vital step towards healthcare that's genuinely centered on the person, where your own experiences help make the system safer and, frankly, more humane for everybody.
Absolutely. But, there's still a challenge looking ahead. A key question for future work is going to be understanding how patients actually decide what counts as a voiceable concern
Mhm.
that they should report using a tool like this.
Ah, right.
Versus just, say, a negative experience that felt bad, but maybe they don't think warrants a formal report.
Yeah, where's that line for different people?
Exactly.
Yeah.
Figuring out that subjective process and also making sure this kind of patient data gets smoothly integrated into the existing safety systems, not just collected and sat on.
Yep.
Those will be really crucial steps to properly transform patient safety across the board.